Hello, everyone. My name is Ashaye. I'm a family medicine physician and owner of InTouch Primary Care in Sugar Land, Texas, where we provide a hassle-free healthcare experience under a membership model with people with and without insurance so you can live longer and you don't have to delay your care. And today I'm so excited because we have Dr. Leslie Golden here. She is an obesity medicine expert and she is going to be giving us some awesome weight loss tips. And I cannot wait to get into it. So sit back and listen. And I hope you learn a lot. And I know I'm going to learn a lot here today. So, Dr. Leslie, Dr. Golden, can you share something about yourself personally or professionally that you want our audience to know?
Sure. Yeah. So, Dr. Leslie Golden, I am a family practice and obesity medicine physician in Watertown, Wisconsin. It's been a great journey for me to find my way into practicing obesity medicine because it really gives me that great, just holistic relationship with patients to try to improve every part of their life. And it's really important to me as well because I'm someone who struggled with weight myself for most of my life, and it's been probably one of the best parts of this journey for me that as I've helped patients, I've also helped myself. And it's just this reinforcing pattern that continues is as I continue to help them get better, it helps me maintain that weight health that I've found for myself as well.
Yeah, that's awesome. That's true, right? Every time we talk to patients, we're somewhat talking to ourselves too.
Right.
So it's very helpful. That's great. So, what is an obesity medicine physician, and is there additional training outside of, medical training that needs to happen to become one?
Sure. So when we call ourselves obesity medicine physicians, usually we've gone through additional training and testing uh, to show that we are credentialed and held to certain standards that we can provide an appropriate and successful level of care. So in primary care in general, we do a lot of care for diseases related to obesity, or maybe we may provide obesity care in and of itself. But when we go forward to get the specialization, there's two pathways. So you can go through a fellowship pathway, which is usually an additional year of an obesity medicine fellowship after a traditional residency program. Or you can do a CME pathway, which usually involves a minimum of at least 60 CME credit hours. So many have to be in person and they have to be at certain approved sites or types of program. And then you have to sit for the board exam and then receive that specialization.
Right. So yeah, lots of additional training needed for that. Yeah, absolutely.
Yeah, and I have to say as a primary care doc, when I first found it, I really thought, I do family medicine. I probably know a good bit of this already. And started an initial course through the Obesity Medicine Association on fundamentals. And it really opened my eyes to how complex obesity is,
Right.
uh, way more than I could have ever imagined, and even more so how complex it is to treat.
Mhm.
Um, I think the certification, the additional education is very valuable.
Mhm.
I hope more primary care doctors become more interested and more accepting of treating obesity as a disease, to have that first initial relationship with the patient and to try and then pass the patient on to an obesity medicine expert if they're not successful with their primary care provider.
Right. Absolutely. Awesome. So I know you've been doing this for a while and you've met a lot of people that have struggled with losing weight. What would you
Yeah.
say are the top three challenges people face when it comes to weight loss?
I think, it's different for so many of us, but I really think the first big challenge that many of us don't realize is just our bodies.
Mm,
Our bodies, we know so much more now than we ever did about how our bodies regulate energy and appetite and body fat. And we're learning more every day. Like, this field is changing so quickly, which is exciting, but a little overwhelming at the same time.
yeah.
But most of us just have no idea that our body tries to defend a higher weight when we've gained weight. When we're not successful, often we blame ourselves. We think we don't have the willpower in these different ideas, and we think we're at fault in some way, not understanding that there are all these hormones that are involved and all these signals between the brain and the gut and the adipose tissue that are driving some of our behaviors in the physiology. So I think that first challenge of not being aware of how complex our body is and regulating the system can be a huge role to play, because once we learn more about that and accept that, we can start treating it as a disease rather than believing that somehow we're at fault, so we don't even seek care. So
Mm-hmm.
I really think that's a big one.
Right.
um, After that, probably expectations.
Mm-hmm.
Whether it's expectations from our past experiences and believing because we weren't successful before, that's always going to be our story. That mindset that we have about unrealistic expectations can really get in the way for many of us. If we make a lot of changes and we only see a pound loss on the scale, we think that's not worth it, and often and we'll give up. And unfortunately, the diet industry has really created some unrealistic expectations for weight loss and weight maintenance, and it really gets in the way of people making these positive changes. So that, I think that's a big one as well. And just the probably the last, probably the lack of support, probably from the medical community and possibly family members too, because so many of the medical community still are not aware of obesity as a disease. So they may not be providing the right guidance or the best guidance or the right kind of support for patients. And that's really a missed opportunity that really puts a patient at a disadvantage for treating the condition when there was an opportunity to.
Yeah, no, I totally agree. I think, you've mentioned the mindset that, having the right mindset going into it makes a difference. And then also expectations. And yes, absolutely. That's a big
Hmm.
one because I have had patients who do something for a few weeks or a month and, they're expecting significant results. And you're like, well, you're doing so good. You're
Right.
excited. And they're so disappointed. And,
Hmm.
it's like, yeah,
I
1 to 2 pounds a month that's great, you know, but they're looking for 4 to 10 pounds.
Right. Yes, and
So,
several inches, and also we forget the other benefits. So many times I see patients that maybe they lost only a couple pounds,
yeah,
but we always make it about the scale weight, but it's so much more than that.
right,
Um, because and if we keep focusing on just that scale weight, we miss so much, right? Because it's also that, more energy.
right,
I can chase my kids around without being short of breath.
right.
I took a load of laundry up the stairs and, didn't slow down. I don't have reflux or indigestion anymore. Like, all these benefits that come along with getting healthier and losing weight along the way,
Hmm.
that we just don't give the value that it should have because we're so worried about that number on the scale.
Exactly. No, that's
Yeah.
exactly right. Yeah, and then the support is you're very right about that. Like having the right type of support can make all the difference. Awesome. So, what are 3 practical examples that you can give people on how to lose weight if they said, "Okay, you've convinced me. I want to start my journey now. I want to start today."
Right.
what would you say are the three or practical tips, as many as you want? We'll,
We'll
yeah,
take them all, right?
yeah,
Yes.
we'll take them all.
Yeah. And I love that too, just the way that you emphasize like, oh, this sounds good. So what can I do now? Because so often we get in our heads of, yeah, I need to make a change. I'm ready to make changes Monday.
Right.
And it's so important that when we get this in the right path, if we're moving forward, we really just have to focus on making that next best choice, right?
Mhm.
And that's where the mindset, I think, is so important. And we don't have to have it figured out all up front, but starting out with a very clear why you want this and not just a number. It needs to be, I want to be able to be here when my kids are 60, and see that multiple generations throughout my family. I want to feel better. I want to be healthier. I want to be stronger. Really have a clear why and decide for yourself, are you going to only make changes if you're seeing what you want, or are you just going to keep trusting the process and be curious and willing to keep trying something else, knowing that what we were doing before wasn't working at all? So it just doesn't make sense to go back to that.
Right.
Um, and today, big change today is just pick small, simple things.
Mhm.
I think so many people get caught up and are even influenced or told that the only way to lose weight is to just upend your entire life.
Right.
And I struggle with that when I hear that being encouraged, because I really believe that people are most successful long term if you just pick something small, something that you're going to be able to maintain, and let that reinforce your goals, let that confidence build, let that belief in yourself that you can make changes continue to drive you forward, and believe these small little changes will add up to something. Because
Mhm.
sometimes all we have time to change is maybe a 5-minute walk each day,
Right.
and that does matter. It will become something over time.
Absolutely. No, I love that. And that's something, but I'll let you finish. Go ahead.
Oh, just yeah, I could probably keep going, but I just see so many times, people are like, "Oh, I'm gonna do 4 45-minute hit workouts, and that's my new goal." And that's tough because the likelihood any of us are gonna maintain that, it's
Mhm.
low. Yeah, sure,
Exactly.
when you're on vacation and life's easy, but if
Mhm.
you have not been exercising, putting those kind of demands on yourself just aren't realistic, and it's going to reinforce that belief of, I can't do
And do
this.
this.
And
Exactly.
that's not what we want at all. So
Exactly.
just so much benefit there. And then reach out for help, I would say, something you could do today. Um, Find out if your primary care provider can help you with weight. And if they can't, find out someone in your area who can.
Yes.
Because we do consider it a disease now. It is complicated. It's not an easy thing to manage on your own. But there's a lot of help out there, and we know more than we ever have.
Absolutely. No, and that's right. Exactly. I think I really like what you said about knowing why, because that makes a huge difference. And I really like what you said about not the why shouldn't be a number, because it needs to be something deeper, something very meaningful to the person, because it makes all the difference in how you approach the whole, how you approach weight loss. So that's really powerful. So that's one thing you can all work on right now, just sitting there and trying to figure out, why is this so important, and really, really asking yourself and coming up with an answer of why this might be important to do. And then the small steps, yeah, I'm a huge proponent of baby steps. That when a patient tells me that they are, going to do something, or they're on a weight loss program, I always ask, Do you think it's something you can do for the next 2 to 3 years?
Mhm.
Because if it's not, you might as well. I mean, I don't want to discourage you, but you're going to finish this up in the next 2 to 3 months, and you're going to
Mhm.
go back to your old lifestyle. And guess what? You're going to gain all that weight back. Like that's just
Mhm.
how it works, you know?
Mhm.
So let
Mhm.
us do well. If we're going to choose something, it's much better to choose something a lot more realistic that can be
Mhm.
done over time so that at the end of a year or two you've lost 20 to 30 pounds in 2 years. That's awesome. That's
Mhm.
sustainable. And we can continue to work with that. So always baby steps is huge, and it makes every little bit makes a difference. Adding a vegetable to your dinner every night, just that small change makes a difference.
Mhm.
Walking for 5 minutes or 10 minutes, 3 times a week is much better than nothing.
It
So
really is.
yeah,
Mhm.
yeah, and reaching out for help. So yeah, those are great tips. Thank you. And is there, if physicians want an opportunity to learn more about obesity medicine, so you had mentioned, and I think that's true, that um, not everyone has caught on completely. What can physicians do to better educate themselves, as soon as possible about obesity medicine?
Sure. There are a lot of resources out there. The Obesity Medicine Association now has a peer-reviewed journal called The Pillars, that is free, that is available. They have a podcast, Obesity, a Disease, that provides a lot of information. And the Obesity Medicine Association has two CME conferences a year. The next one is October 12th to 16th in California. And it's just a great opportunity to be around a lot of wonderful providers that are passionate about this field and love to share it, and just learn more about treating really the most prevalent chronic disease in our country. And it's really uh, it's our pandemic that,
Yeah,
I know there's so much gone on with COVID, but obesity, I think, is going to continue to be the pandemic that America isn't able to address as quickly as we need to.
yeah, yeah. No, that's right. And I know we didn't talk a lot about why it's so important. We know that obesity is related to so many health conditions, and why it's important to try to lose weight, because some people might feel like, well, it's not such a big deal. And I'm comfortable with my weight. Why do I have to lose weight? Right.
Sure.
So,
And that's a conversation I have a lot. And some people get uncomfortable with that conversation. I actually love that that conversation. Because I like to remind everyone that, we're not talking about attractiveness. We're not talking about beauty.
mm,
We're not talking about self-worth. Someone's weight has nothing to do with those things.
right.
We're just talking about the health and how increase adipose tissue can impact someone's health. And it's very often, I'm someone who's been in that position before myself where, well, I don't have diabetes. My cholesterol looks great. I don't have high blood pressure. Um, I'm from the South, so we're used to thinking, in our cultures to have more meat on our bones, and that's what we want. And
Mhm.
so it's not about attractiveness and it's not about your value, because that is all there regardless of what the scale happens to say or what your body fat percentage is. It's just, what is your health right now? And if you're not unhealthy related to your weight yet, amazing, awesome, but
Right.
it doesn't mean it's going to stay that way,
Mhm.
because we still have to worry about our joints and the risk of cancers and diabetes down the road and heart disease. Those things are still looming out there for us if we continue to have just a higher amount of adipose tissue than our body can handle.
Right. Right. And I like the way you put it. Perfect. I have nothing to add. So, um, so, do you have any parts and words, anything else you would like to tell our listeners today?
I would just want to encourage everyone to not be afraid to advocate for yourself, because we're in a world right now that there's so much more information available about our weight health and obesity, um, but there's still a lot of shame and blame going on,
Mhm.
and because of the history of stigma about towards obesity. Uh, there's some barriers to care. And right now there's legislation out there, the Treat and Reduce Obesity Act, that is trying to we're trying to get it passed to guarantee care for behavioral therapy, for medications, scientifically proven methods to treat obesity. And until we're able to get measures like this passed, we're still allowing the stigma about obesity and inaccurate beliefs about it to continue and prevent us from being able to get the care that we need and provide the care that we need. So I would just encourage people, if you've been a victim of bias and stigma through the medical community, I know it's there. I'm sorry. Find a provider that will work with you, and definitely advocate in your state for passing bills like TROA to provide equal access to care.
Awesome. Yeah, thank you. Thank you for sharing that. And if you're in the Wisconsin area, what city are you in?
Watertown, so I'm
Watertown.
halfway between Madison and Milwaukee, so
Okay.
pretty
And
conveniently located.
how can people find you?
So I have a platform called Weight in Gold, like Worth Your Weight in Gold Wellness, on both Facebook and Instagram, and watertownfamilypractice.com to schedule appointments.
Awesome. Yeah. So if you're in that area, please check out Dr. Leslie Golden. She has very, very good information on obesity. And if you are in the Texas area, we're in Sugar Land, Texas. This is Connecting the Dots with Dr. Ashaye. And it's always a pleasure to have people here learning everything they can do to live a healthy lifestyle. Thank you so much, Dr. Golden, for being here. Really
Wonderful.
appreciate it.
Th-
All right.
Thank
Have a
you.
good rest
Thank you.
of the day. All right. Take
You
care.
too.
Bye bye.